To many, there is no greater feeling than knowing that you are in control of your body, that it will never let you down. But on the off chance that it does, what do you do? The risk of developing myeloma increases with age and family history. Myeloma is a blood cancer of the plasma cells of the bone marrow.
In a healthy person, the role of plasma cells is to produce antibodies against infectious agents.
Myeloma occurs when normal plasma cells become cancerous and multiply uncontrollably. When these cells overcrowd the bone marrow, outnumbering normal blood cells and limiting the production of healthy blood cells, this can cause anemia, excessive bleeding, and a decrease in the ability to fight infections. In the early stages of the disease, it can only be detected by routine blood tests. However, as it progresses, patients with myeloma experience various symptoms. Myeloma causes bones to weaken, leading to bone pain and increased risk of bone fractures. When an excess of calcium is released into the bloodstream from bone destruction, patients may feel muscle weakness, loss of appetite, nausea and vomiting, amongst other symptoms. With fewer healthy red blood cells being produced, patients can experience anemia, which causes fatigue, weakness, dizziness, and shortness of breath. Myeloma patients are more prone to infections and take a longer time to recover when they come in contact with viruses or bacteria. This is due to the decreased production of healthy white blood cells and functional antibodies, which are the body's soldiers. The production of platelets is also decreased as a result of overcrowding in the bone marrow. This leads to increased bleeding and blood clotting issues, especially in the event of cuts or scrapes. While there is no known cure for myeloma at present, it is a treatable disease that can be managed successfully for years with a variety of treatments. Treatment outcomes are continuously improving, and advancements in care have greatly improved survival rates and quality of life for most patients, especially if caught early. CRAB stands for common symptoms that myeloma patients experience, namely calcium elevation,
renal failure and recurrent infection, anemia, and bone pain. When your symptoms start appearing, the first course of action would be to go through a series of tests to confirm the presence and stage of multiple myeloma.
These tests include blood and urine tests,
imaging studies such as X-rays and CT scans,
and bone marrow aspiration or biopsy. After your diagnosis is confirmed, the best course of treatment will be determined for you. Treatment for myeloma can help to destroy cancerous cells and alleviate symptoms. Depending on the stage of disease, treatment can vary from drug therapy, radiation therapy, to stem cell transplantation. Many patients who respond well to treatment with the signs of cancer diminishing will be offered maintenance therapy.
Patients in remission may need to continue maintenance therapy, while others may have relapsed or refractory multiple myeloma where the cancer may become active or progress after a period of remission, which will require further treatment. At the National University Cancer Institute Singapore, or NCIS for short, we are with you at every step of your journey. At the beginning, you will be introduced to a nurse navigator who will be your first point of contact for day-to-day patient support. The nurse navigator will also provide you with resources, emotional support, and can be contactable if you have any concerns. The nurses play a crucial role during your time with NCIS. They provide you and your family with ample support, along with administering your medical examinations and drugs. Along with the nurse and nurse navigator, our team, which includes dietitians, physiotherapists, occupational therapists, medical social workers, and research coordinators will support you in this journey. Myeloma can be a long and tough battle, but we will stand by you and your family as you embark on this difficult journey. With the right treatment and care, you can make the most of your journey and ensure you always have time and strength for what matters most.